a stance that we've taken as an international community to say we are not okay with programs that don't have choice.
The music in the way you talk about it, I mean, it's really good. What I'm trying to say is, if at all, I mean, when do I, as a person, feel that I need to do this? That's what I was trying to figure out.
Yeah, yeah,
I think you've answered most of it. I mean, you will make the person tell you why he has come to you,
yeah,
or rather, figure out why he has come to you, right?
right.
Okay,
Yeah,
so I mean, how to reach Tanya? I'll be giving her Instagram handle and the website in the description and also in the video that
sure.
you can reach Tanya in that.
Yeah,
One last question. You've been attending a lot of international conferences on outdoor therapy. You've been in touch with a lot of international practices in this domain.
yeah,
What, in your views, are the international trends that has come up in this outdoor therapy in the recent years, or the road ahead?
sure. Yeah. Uh, so the last conference I attended was in Norway in June in 2022. And during that conference, I think right now the conversations are a lot around decolonizing the field, around diversity and inclusion in this space, because actually it is a very, like, if you look at the conference, a lot of those spaces are dominated by countries that have had this field around for a very long time. So there is, of course, like North America, there is parts of Europe, there's Australia, and there is very like less representation comparatively from other parts of the world. And this personally, I really think that's because we have experienced the disconnection from nature for far lesser time. I think they have been disconnected for a longer time, and so they have needed a field like adventure therapy, right? Because still in parts of this country, if you say adventure therapy or nature-based therapy, outdoor therapy, they're like, "What are you talking about? We don't need that. We're going to our fields every day. We are doing this work. We don't really need this." And but at the same time, there are also parts of our country now that are very, very disconnected, right? So the focus in the international community, and that's what we're working on. I'm also the representative for India on the committee. And what we're really working on is making scholarships accessible to people who want to attend from countries where they can't afford to be there. So actually creating funding for that to happen, so that these voices are also allowed to be present, right? Because actually folks from these contexts where adventure therapy maybe is quite new as a field, like India, we have a lot to offer these other countries, right? I think that's what we're realizing. That's what the whole international community is realizing, that you're missing out if you don't have indigenous voices, if you don't have people of color, if you don't have folks with disabilities or folks from the queer community. Then it's a loss for the field, actually. So we need to include people from marginalized identities, so that so that and for that we need to make funding possible. That's a very real challenge then that comes about, right? So that's one, like to look at true inclusion and what that means, and collaborating with like acknowledging indigenous communities that have actually been protecting this earth and planet for all of us for centuries. So that has really been something that I feel like even in Australia they do that really well. They're teaching the whole world how to acknowledge the traditional custodians of the land, to actually acknowledge indigenous populations and work with them and learn from them, and honor the place that they come from. So that's really big and it's really important. So there are a lot of, even in North America, a lot of conversations around that within the field. um, and I think apart from that, also conversations around ethics. So there are we're really looking at that this kind of program needs to be voluntary. It cannot be forced on to someone and you cannot call it therapy after that. right? Because you are working with people who've been through trauma or are actively dealing with trauma. So there has been a stance that we've taken as an international community to say we are not okay with programs that are not that don't have choice for participants. So there's a conversation around that as well, that people need to come in voluntarily so we don't re-traumatize them. And in different contexts, there's different way of dealing with that. But we're on the same page about this, that it needs to be handled with care and choice for all involved. Yeah.
Now, this being a relatively new niche, a niche where a lot of public awareness need to be created. I mean, it is not there as of now. There'll be, what are the certifications involved in this, and how do we differentiate between a genuine forest therapy, outdoor therapy practitioner and a fake program? How do a layman differentiate this?
Yeah, that's such a good question, Abby. I think there are a few ways, right? Like I think it's totally important and okay. And this is the same thing I say to my clients when they're looking at mental health professionals, to ask people about their training, ask about their qualifications, ask about ask those questions, because as a client or as a participant, you deserve access to that information. And I think that's also what we're doing. Even with mental health spaces, we're also needing to educate people around how to access a good mental health provider. So currently, I think it's important because there are no courses for adventure therapy here in India yet, specifically for that. So what we're having to do is cross train, right? So I'm trained in mental health, and I'm also needing to go train in outdoors, or work with people in my team who are trained in outdoors, and both of us kind of cross train each other. Having said that, we are working on a training program. In fact, after the Norway conference that I went for, one of the things that happened immediately, which is amazing, is that there are scholarships available for Indians, to a full scholarship for programs in Australia. And these are short-term programs, like for a week or so, but they're completely, you as long as you can make your way there, you can access that program. If you After applying, of course, if you're accepted, then you can access that program completely for free. So we are also doing these inter-country collaborations, and we're coming up with trainings that are like an international training. And even back in 2018, I attended a workshop where we've identified what are these training components that we're looking at, that are sort of across the board skills that people need. And I'll also be having international colleagues visit India and offer trainings over here in person in this year. So if anyone's interested, then do reach out and I'll let you know, because I get a lot of.
When did you say this is? Which month?
This will be in October this year.
Okay.
We're still to decide the location and the format of that, but there are also colleagues who are interested in visiting and learning from us, not to, and also kind of, cross training, right? So that's one. And also this was also in 2020, I think, in the pandemic, we started an online study group where we just brought people together just to see, to gauge who's interested in this. And we had folks from the outdoors, we had experiential educators, we had mental health practitioners, just interested in learning more. And we invited our international colleagues to come and share their practice with people, and just to give an idea of how diverse this field is. So it's a lot about finding your own sort of like what appeals to you as a practitioner and a person also, right? And then practicing from that. So for me, hiking is something I really enjoy. I don't think I would be very good if I was, as an outdoor therapist, if I was taking people in any kind of water-based activity, for example. But it took me time to figure that out for myself, and then know, like, okay, this is what I'm good at. This is what I enjoy. And as a therapist, this is where I'm at my best. So that's what I've realized.
You mean to say that there's no uniform pattern in the therapy per se? Every practitioner molds it according to their liking or rather their
Uh,
strength?
in terms of the activity, yes, but then there is a ton of research to look at, and there's a ton of research to look to back up what are the ways in which we need to be doing this, what are the elements that we need to consider. So yeah, it's not like I'm saying in terms of just choosing the medium, right? Like, are you going to work with taking people out canoeing? Are you going to do climbing? Those are things you have to figure out based on where you are most comfortable as a facilitator. And then of course there are structures and there are programs all over the world that have documented how they are designing their programs and shared it openly with people. So then there is a very sort of evidence based way to go about it, for sure. um, so I think we'll be restarting the study group also. We're just reformatting things a bit to see how to move forward with it. But there will be more training opportunities to look forward to in India as well in the near future.
Thanks, Tanya. It's been great talking to you. Even I didn't realize that we talked for more than 30 minutes now. I mean, it was really
Oh
good.
no, we were gonna make it 15, I thought.
Thanks a
Sorry.
lot. Thanks a lot and wishing you all the very best.
Yeah, thank you so much.